A significant number of residents in Ohio are facing the prospect of steep increases in their insurance costs, and the implications are alarming. Experts predict that over 500,000 individuals in the state may lose their insurance subsidies starting next year, with estimates suggesting that more than 100,000 could ultimately lose their coverage altogether due to these rising expenses. But here's where it gets controversial. Ohio's U.S. Senators John Husted and Bernie Moreno, both Republicans, have not indicated whether they will take action to renew the crucial subsidy program. This subsidy, known as the Enhanced Premium Tax Credit, was established during the COVID-19 pandemic to help make health insurance purchased through the Affordable Care Act, ACA, marketplace more affordable for many Americans. This financial assistance is available to individuals and families earning between 100% and 400% of the federal poverty level. For instance, a family of 3 qualifies if their annual income falls between $26,650 and $106,600. Currently, nearly 20 million Americans, including approximately 530,000 Ohioans, benefit from these subsidies. In fact, over 90% of those who obtain insurance through the ACA marketplace rely on these credits to keep their premiums manageable, and they are set to expire at the end of this year. On average, recipients save about $700 annually due to these subsidies, according to the Center for American Progress. However, some individuals save significantly more, which means they stand to lose a lot if the subsidies are not renewed. For example, a typical couple aged 60 with an income of $82,000 could see their monthly premiums skyrocket from $581 to $2,111, resulting in an annual increase of approximately $18,400. These subsidies have played a vital role in reducing the number of uninsured Americans to an all-time low. This success may explain why, despite initial skepticism, a substantial 66% of Americans held favorable views of the ACA by June 2025. After attempting to repeal the ACA during his first term, former President Donald Trump has implemented several measures that experts warn could significantly increase the number of uninsured individuals. One such measure includes cutting nearly $1 trillion from Medicaid over the next decade as part of his One Big Beautiful Bill Act. This legislation provides substantial tax cuts to the wealthiest 1% of Americans while adding $3.4 trillion to the national deficit. The anticipated cuts to Medicaid are expected to exacerbate the issue of uninsured Americans. The Kaiser Family Foundation, KFF, an independent nonprofit organization, estimated in June that around 11 million Americans could lose their insurance due to these cuts, with 310,000 of those being from Ohio alone. This would result in a 3% increase in the uninsured rate in the state. Emergency room physicians have raised concerns that a sudden influx of uninsured individuals will place immense pressure on hospital services, particularly in rural areas where healthcare facilities are already struggling. Emergency rooms are legally required to treat all patients, regardless of their ability to pay. To manage the financial burden, hospitals may be forced to reduce staff, leading to longer wait times, fewer available services, and ultimately poorer health outcomes for all patients. Experts warn that the expiration of marketplace subsidies would further worsen the situation. KFF estimates that when combining the loss of these subsidies with the anticipated Medicaid cuts, around 16 million Americans could lose their insurance, including 440,000 residents in Ohio. If Congress allows these subsidies to lapse at the end of 2025, those currently benefiting from them will feel the impact before those affected by Medicaid cuts, as the latter will not take effect until after the midterm elections next year. Americans for Healthy Communities, a nonprofit advocacy organization, has called on Congress to renew the insurance subsidies. They stated, by failing to renew the ACA's premium tax credits, Republicans in Congress are jeopardizing the health of more than 500,000 Ohioans who rely on these credits to receive the care they need. We urge Congress, especially Ohio's delegation, to quickly come to the table and work together on passing an extension of these tax credits before it's too late. Congress still has a chance to renew the tax credits when they return in September. However, if they once again refuse to, millions will lose their coverage and millions more will face unaffordable high premiums. The time to act is now. Interestingly, when asked whether they believe the insurance subsidies should be allowed to expire, the offices of Senators Husted and Moreno did not provide a response. What do you think? Should Congress prioritize the renewal of these vital subsidies, or is it time for a different approach to healthcare funding? Share your thoughts in the comments.